Hello, Assalamu alaikum. I am Dr. Sanali, a third year MBBS student at Chatka Medical College, Larkana. I am here to teach you the pathology from the Robbins Basic Pathology book. I have started from the chapter number 2, that is inflammation and repair, while I will discuss the cell injury later on. So today I will give you the overview of inflammation and tissue repair. So what is inflammation? Inflammation is actually the protective response involving the host cells and blood vessels and proteins and other mediators that is intended to eliminate the initial cause of the cell injury as well as the necrotic cells and tissues resulting from the original insult to initiate the process of repair. Inflammation is actually the beneficial response because it causes the protection of our host from the infectious agents. However, it may be harmful in the cases of the autoimmune diseases or when the infectious agent is very strong or in the cases of the allergic reactions. Cells and molecules of the host defense, including the leukocytes and plasma proteins, circulate in the blood, and the goal of the inflammatory reaction is to bring them to the site of the infection or tissue damage. There are the two types of inflammation: acute inflammation and chronic inflammation. So what is the difference between the acute inflammation and chronic inflammation? As we have already learned about the word acute and the word chronic. The word acute means fast onset, while the chronic means slow onset. So if we discuss about acute and chronic inflammation difference, so acute inflammation occurs within few minutes to few days, and the cells involved are only the neutrophils, and it is a mild and self-limited response, and the local and systemic signs are prominent in the acute inflammation because it is actually visible form of the inflammation, while the chronic inflammation may be the more insidious and is of the longer duration. It occurs appears from days to years and is typified by influx of the lymphocytes and macrophages with associated vascular proliferation and fibrosis or the scarring. Fibrosis means scarring. So chronic inflammation is less prominent as it is chronic in onset and we cannot distinguish it from the normal body. Inflammation is induced by the chemical mediators that are produced by the host cells in response to the injurious stimuli. The external manifestations of inflammation are called the cardinal signs of inflammation. So, four cardinal signs are given by the Celsus. These cardinal signs are the Kähler, Ruber, tumor, and Dollar. Kähler is for the heat, Ruber is for the redness, tumor is for swelling, and Dollar is for the pain. While the functional acia, that is the fifth sign of the inflammation, was given by the Rudolf Virchow, who is the father of the modern pathology. Inflammation is a self-controlled and limited process, and the mediators and cells are activated only in response to the injurious stimulus and are short-lived. So, this response is ended after the removal of the pathogen, either because the mediators of the inflammation are short-lived or because the anti-inflammatory reactions initiate after the removal of the pathogen. So, in the summary, we have the one different point that is not mentioned previously, that is the steps of the inflammatory response. So what are the steps of inflammatory response? How many steps are there? Here are written the 5 steps of the inflammatory response. That is, the first step is the recognition of the injurious agents. So recognition of injurious agents is important as it will help us know that how much inflammatory reaction is required. Number second step is the recruitment of the leukocytes toward the site of the infection. Third is the removal of the infectious agent. That is the most important step, that we have to remove the infectious agent. And then number fourth is the regulation of the response so that the inflammatory reaction should not harm our own cells. And number fifth is the resolution or repair, in which our scar formation occurs. So outcome of inflammation are either the decline of the reaction or the repair of damaged tissue, or the persistent injury of host will lead to the chronic inflammation, and then chronic inflammation will deal with the few more type of the leukocytes that will result in the more inflammatory reaction. So that's why it is called the chronic. So thank you so much for listening to my lecture. Kindly subscribe my channel, and I will be here available for each and every question if you want to ask. And thank you so much